Hi, everybody. So sorry about that. This is take three. We've had a couple power surges out here in the country where I am. And when it power surges and cuts off the power, it knocks my booster out. So I didn't have internet. So we'll try this for a third time and see if we can get through this material. Thank you guys for hanging in there. So sorry about the technical difficulties. We will try again. I'm going to pop into my phone here to see if we are actually live. Let's see. Okay, there's Betty. Hi, Betty. Take three. Hey, Annie. So let's see if this time my internet and the weather will cooperate. So let's get started again. If you guys heard the first 5 minutes before, you'll know that I talked about a disclaimer. This is a very in-depth topic that I tried to pare down, and really every disorder could be its own presentation. But we're trying to go through a lot of things in just a few short weeks and give you the high-level stuff that you need to know so you can support your body through an autoimmune disorder or those that you care about. So the disclaimer, hey, Amanda, hey, Betty. Thanks, Amanda, for the technical support. Jana, Annie, good to see you guys on live. So another disclaimer is this. Yes, I'm a medical professional, but I'm not giving recommendations in this format as a medical professional. I'm giving recommendations as a certified wellness practitioner. And I think it's very, very important, especially if you have advanced autoimmune disorders, that you partner with your physician and the medical therapies that they're using to help your autoimmune disorder, and always be forthcoming with them about some of the integrative things and natural things that you're doing too. A lot of people are sometimes afraid to do that, especially because maybe physicians are not as well versed in essential oils. But this is your opportunity to educate them on some of the things that you're doing to support your body. And most of them are very open and very thoughtful about hearing what you want to do. I would say 95% of physicians are open to hearing the other things that you're doing. And it's very important that you explain to them what you're doing, so they can make sure that it's appropriate for also combining that with your medical regimen. So I strongly, strongly suggest that you combine modern and integrative medicine when supporting your body through an autoimmune disorder. So with that disclaimer said, let's move forward, and we'll hope the internet cooperates. And if you guys have any questions as we're moving throughout the content, please, please, please just go ahead and post them in the comment section now, because it's likely that someone else is thinking the same question and we can get it answered here. So this week, I kind of lumped together supporting systemic and skin autoimmune diseases. And just keep in mind, this is not all encompassing. There's over 100 different autoimmune disorders. We're just touching on the most common. So tonight we'll be talking about lupus. Mixed connective tissue disease is actually sort of an overlapping autoimmune disorder with lupus. A lot of times people that have lupus-like symptoms, but they don't sort of fit some of the diagnostic criteria, will actually be lumped into this category called mixed connective tissue disease, or MCTD. Arthritis, rheumatoid and psoriatic arthritis, but please know that the quote-unquote osteoarthritis of old age, you could also apply some of these regimens to that disorder, because it is an inflammatory disorder in and of itself. We're going to talk about the thyroid, Hashimoto's, and Graves' disease, both sides of the topic. And then, of course, we'll talk about skin autoimmune diseases. And the skin is very basic. We just did the top two most common ones. This obviously is not all skin autoimmune diseases, but these are the ones that are the most common that we deal with on a regular basis. So let's start with the basics. You have to always start here when you are dealing with an autoimmune disease process. Everything that you see on the outside of your body, your skin, anything that happens for you systemically is always a reflection of what's happening inside the body. So if the outside looks haywire, the inside is haywire. And we are learning so much about the gut right now. And I have been doing intensive study over the last year about gut health and the developing diagnostics that we have to understand more about the digestive system and really the second brain that is our gut. So one thing that I've learned about the last year and that we are now doing testing for the Organic South called GI mapping is gut pathogens. There's an entire collection of about right now 7 that we're testing for gut pathogens that we know are actually a precursor to rheumatoid arthritis. And so what's interesting is that if we look at this from a preventative aspect, we can actually capture these pathogens early, destroy them in the gut, reflourish the gut with positive bacteria, healthy bacteria, and stop the process of this particular autoimmune disorder from occurring. And you guys, this is big research in and of itself, because if we can stop that, what about other types of autoimmune disorders? This kind of proves this myth that autoimmune disease is purely genetic. We know that's not the case, as we learned in week 1 during the overview. So testing and getting the GI mapping done of your gut gives us a very clear picture about the pathogens that we're dealing with, and could they be triggering an autoimmune response in your body. Next, removing potential triggers. So food. I can't tell you how many times I've heard people say, well, that has nothing to do with diet. That has nothing to do with diet. Everything that happens in your body has to do with your diet. Now, there may be other factors going on too, but whatever you put in is what you're going to get out. And so when you're dealing with an autoimmune disorder, you are much more sensitive. A lot of times people with autoimmune disorders have sensitive digestive systems as well, or dealing with something called leaky gut, which is becoming a phenomenon that is actually being proven to be true. And so foods that can typically be inflammatory are modern day wheat. Notice I say modern day wheat because wheat has been changed a lot over the last 50 to 100 years, and it's very inflammatory now, and it's very gluten laden. Grains can actually be difficult. And remember, when we go back and heal the gut, sometimes you can reintroduce grains and be okay. But for those of you guys that are suffering right now through an autoimmune disorder, I always have people eliminate these. Wheat, grains, dairy, absolutely sugar. Sugar is your absolute worst enemy. If there's only one thing you can eliminate on this list, eliminate sugar. Any sort of processed foods, and when I say processed foods, things that come in a package, things that have canola oil in them, things that have MSG in them, things that have artificial dye, anything artificial. BHT is a common preservative in food that is known to trigger certain types of diseases actually when consumed in large enough quantities. And this is why I talk about organic, because glyphosate, Roundup, is known to be in parts per million on so much of our food. Our food is saturated, especially genetically modified corn that is actually genetically modified to be resistant to Roundup. They're using a ton of it on modern day wheat. They use it to dry out the wheat. They use it on most of your food that's non-organic. And so I actually recommend a Whole30 diet for people that have an autoimmune disorder to start there, because it gives you the opportunity to remove a lot of those inflammatory foods and then reintroduce them to see what really triggers a problem with your body. And sometimes people will continue on Whole30 for a long time because their symptoms almost disappear. I've seen this with clients personally, and it's pretty amazing. Next, detox your environment. So you guys know I'm a big stickler about this. We are inundated with chemicals in our environment. Chemicals can certainly trigger different types, especially skin autoimmune disorders, because we're exposing the skin and we're exposing our body. Things that you inhale, cleaners, personal care products. And maybe if you're using 1/10 of them, it's not toxic to your body, but your body has a toxic load where your DNA actually starts to change, and we start to see hormonal disruption. We start to see DNA changes, especially with pesticides. So detox your environment, make things simple. This is why we love essential oils, of course, because they give us a natural solution for a lot of problems, and we can eliminate 90% of the over-the-counter and the cleaning products that we use. So you really need to be very thoughtful about going through no more Windex, no more Pine Sol, no more bleach, No bleach baths, for heaven's sake, no bleach baths. You're destroying the microbiome in your body. And detoxing your environment from any sort of chemicals. And this is where you have to start questioning everything. Any sort of thing that could be emitting chemicals into your home, synthetic fragrances. You just really have to become your own detective in this arena and ask a question. So we typically recommend the Cleanse and Restore program that doTERRA has for 30 days. Especially if you're not ready for GI mapping yet to get that diagnostic. The Cleanse and Restore kit actually has a wonderful product that can help eliminate gut pathogens and then restores the gut microbiome. And there's a whole kit doTERRA has. It's called the Cleanse and Restore kit. And it gives you this whole regimen on exactly how you do it. Digestive enzymes with Terrazyme. So we love the Terrazyme product. And why digestive enzymes can be supportive through your body through an autoimmune disorder is because sometimes if the gut is not healthy, then we're not producing enough digestive enzymes. You have all these beautiful little hairs and cells within the digestive tract that actually produce enzymes and help break down your food. And so a lot of times, if the gut is unhealthy in an autoimmune disorder, especially in systemic disorders and most of the time with skin, then you'll see that people are not properly digesting their food and they have poor nutrient absorption. So we need to assist the body with that. And we typically recommend 1 to 2 Terrazyme daily with every single meal before you take the meal. So a lot of people will do it with the meal. You need to take it on an empty stomach, okay? Because that sort of preps the digestive system with those enzymes to break down your food. And you can open one of these pills and watch it literally dissolve a bowl of oatmeal, which is fascinating. So probiotics with PB Assist with every meal. This is extremely important. As we go through the recommendations, you're going to see that I'm recommending 30 to 50 billion. It's called CFUs, colony forming units. That's just the little bacteria that are in there. And I recommend 2 to 3 with every meal to get enough. One probiotic of PB Assist with doTERRA has 6 billion CFUs. The reason why I choose doTERRA's is because they are double encapsulated. So if you've ever seen them, you will notice there's actually a capsule inside of a capsule. And that is so it doesn't die in your stomach acid. You have a very low pH in your stomach meant to kill bacteria and to digest your food, and it can harm those probiotics. So a lot of times if you're taking a probiotic that's not double encapsulated, so sorry, it's not doing you any good. It's not getting to the small intestine and it's dying in your stomach acid. Okay, so again, we're always going to start here. This is the foundation of anything you're going to do to help support your body through an autoimmune disorder. Okay, so let's dive in. This is going to be a long Wellness Wednesday, so just stay with me. Grab a glass of wine. Week 2, systemic autoimmune diseases, or SLE, systemic lupus erythematosus, or what we call lupus disease. This is for sure, I would say, one of the most systemic diseases that we see related to an autoimmune disorder. Can affect multiple organs throughout the body. I've seen patients sick enough with this disorder to be in the ICU, in kidney failure, in heart failure. It's a debilitating autoimmune disorder. Patients can see anything from what we call like a malar rash along the cheeks, and it typically has a presentation of a butterfly-shaped rash on the face. We'll see hair loss, swollen lymph nodes, an activation of the immune system, right? Mouth ulcers, lots of joint aches with lupus, chest pain. They actually get things called pleuritis, where the lining of the lungs can actually get inflamed. This can also happen in lupus around the heart. They can have lots of what we call pericarditis, where the lining of the heart actually gets inflamed. Definitely the kidneys are often affected, and many people go into kidney failure and end up on dialysis, unfortunately. It affects the central nervous system, but typically you see a lot of joint pain. Some of them have some overlap with a phenomenon called Raynaud's phenomenon, where the fingers and toes are cold and will turn blue. Especially in cold weather, it's really bad for people. And arthritis-like symptoms with, yes, lots of joint pain and lots of fatigue with this disease process. Sometimes you'll see people that present also with what they call antiphospholipid antibody and syndromes of clotting. So they're prone to clots, and that can be very difficult. And so you're going to see this natural support regimen that I'm describing as sort of also the basis, just like we talk about the gut problems, as the basis of how we treat all autoimmune diseases. So when I start working with a patient, like I said, this is in addition to if you're already on medications. You can do this in conjunction because these are foundational things. These are natural things that are going to support the body. So the DDR prime soft gels that doTERRA has, and the reason why we choose those is because rather than you making a veggie cap of frankincense, letsea, lemongrass, all these different oils that we know help support the immune system and help stop inflammation in the body. They halt cellular inflammation in the body. We know that through studies. doTERRA has made it into little soft gels. So it's a blend, and you can get it in the bottle or in the soft gel. So that's going to be recommended 2 of those daily with meals. The Lifelong Vitality Pack, which is your basic vitamin pack, right? And the reason this is important is because many people with systemic autoimmune disease actually have vitamin deficiencies because the gut is not healed. So that gives you a great multivitamin. It gives you another cellular repair complex, okay, the Alpha CRS, which has some of your turmeric in there, all of the polyphenols from food that you need to help heal your body. And then the most important thing in there, omegas, okay? So the omega fatty acids are very, very important, especially in lupus. There's some studies on this about the importance of omegas in stopping some of the inflammatory response with lupus. Probiotics with the PB Assist, 30 to billion CFUs every day. That's up to 3 probiotics per meal. And very important in lupus is vitamin D and calcium supplementation, especially vitamin D. Some literature to support when vitamin D levels were adequate, people with lupus had less symptoms and were less symptomatic. So doTERRA actually has what's called a bone supplement, and it has that vitamin D3, which we need, plus calcium in there. 2 to 4 drops of the turmeric essential oil daily. And why this is very important, most people don't want to eat raw turmeric every day, but the turmeric essential oil has the wonderful turmerones from it. And in the Lifelong Vitality, you're getting their curcumin, which is very important from the turmeric. When those 2 are combined and taken together, you have 7 times the bioavailability of that strong anti-inflammatory root that we know that is wonderful for our body. Again, if you can eat raw turmeric every day, fantastic. But this is a wonderful way to supplement and get some of those anti-inflammatory effects into the body. And then, of course, Copaiba soft gels 1 to 2 daily. This is our wonderful friend that works on our cannabinoid 2 receptors. It works beautifully in the gut and helps with the immune system. So that is going to be the natural support regimen from an essential oil and herb standpoint, as well as probiotics, vitamins that you're going to see throughout this presentation. That is the mainstay of what we typically recommend to support your body through an autoimmune disorder. Okay, so let's talk about some of the symptoms of lupus and what you suffer from, and some of the different essential oil regimens that you can use to help with that. So joint pain, swelling. And remember, when we go back to symptoms, without me having to talk all the way through this and bore you guys, just remember this. If you're having a specific symptom associated with that autoimmune disease, go back to some of our stuff on pain. Like we've done a month of how to support your body through pain. Go back and listen to some of that education, because you're going to get a lot of protocols there to make sure you're supporting your body through the pain process. So topical deep blue rub, lemongrass, lavender, frankincense, copaiba. Topical, we always treat topical to the joints, right? And the area that we're having pain before we move to internal regimens. Now, I would say if you find yourself having to make a veggie cap, often for pain support during, lupus flares. You can sometimes have flares in this disease process. Really look at that deep blue polyphenol complex that doTERRA has. This has something interesting in it. Remember, the DDR prime has frankincense in it, okay? So we're taking that for anti-inflammatory effect. But the deep blue polyphenol complex has the resin of frankincense in it, which still has some wonderful properties that we lose in the oil that are wonderful anti-inflammatory agents. and lots of other herbs in there that we can't get essential oils from that are wonderful for pain. Chronic pain are wonderful for pain support, okay? It's going to support your body through that pain that you're having. Copaiba soft gels as needed. And again, eternally, you can sort of make a pain regimen, a pain support internal regimen, which is typically what we recommend: 2 drops of frankincense, lemongrass, marjoram, copaiba, lavender, in a veggie cap. Now, I say don't overdo this, because remember, over here in this natural support regimen, you're already taking some turmeric internally, copaiba, DDR prime soft gels. So let's not double up on this, okay? That's really important. When you're in this process, especially if you're on medications, you need to be counting your drops that you're taking internally. We don't want you guys going over 24 to 25 drops of essential oil in a 24-hour period. And that is because your liver has to process these just like it does a medication. And so we don't want to cause any problems with that. We don't want you overdoing it. So make sure if you're using a lot, to consult your physician, and also consult the person who's got you started on oils, or ask a question in the Essential Oil Solutions group, especially about what's too much. And remember, if you're having to do that, make sure you're doing topical plus the internal. Okay, so for the butterfly rash symptom, think skin inflammatory protocols. So this is a wonderful anti-inflammatory nightly mask that I love to use for people that have skin disruption from autoimmune disorders. With Manuka honey, true Manuka honey. I love the brand that you can get from Costco. It's proven to have the right Manuka honey, measurement content that they do to prove that it's true Manuka honey. I add 2 drops of turmeric, 2 drops of yarrow palm, plus a swipe of the rose oil. And you can add these to your nightly regimen with the Barrage Serum. The reason I like the Barrage Serum is because it's got jojoba oil in it, and it's got all those wonderful anti-inflammatory oils in it. It comes in the green little bottle. So you can do the Manuka honey mask, and then with those oils, let it sit for 10 minutes. And then when you wash your face, add those same oils to your nightly regimen with the Barrage Serum and rub into the skin and the rash. And what you should see is resolution of some of the redness, okay? And remember, this is not getting to the root cause, but we're working to support the body through a symptom. Kidney support is going to be with our lemongrass and juniper berry, topically over the back flank in the kidney area, and then lemon essential oil, 1 to 2 drops daily in your water. I would say if you are drinking, 750 ml, like put 1 to 2 drops in that, maybe twice a day is great. That just helps to keep the body hydrated and also to keep flow very well. Lemon is a very cleansing oil. It's cleansing to the kidneys. Okay, respiratory season of support. And listen, when I talk about this within the realm of lupus and this systemic autoimmune disease, please know excuse me, that this applies to all autoimmune disorders during the respiratory season. When I say respiratory season, I mean cold and flu season. People that have autoimmune disorders, diseases, have to support their body in a different way when these respiratory season things come up, because the immune system is weakened. Typically, if you're on a medication to weaken the immune system in an autoimmune disorder, you are much more prone to developing catching some sort of viral illness, which typically those upper respiratory infections are viral illness. So this is the way that you're going to protect your body from that. Yes, on guard, on guard, on guard. Okay. I actually love for people with systemic autoimmune disorders to actually incorporate the Kids Stronger blend into their topical regimen of On Guard, because it has rose, frankincense, lucia. It's the only way from doTERRA that we can get lucia. We can't buy that individually, but it's a wonderful immune oil, supporting oil. So On Guard nightly to the feet with the Kids Stronger blend. If you've been exposed, excuse me, or if you're flying in a plane, if you're in an enclosed space, if you're going to a party, anytime you're in a group of people, On Guard On Guard beadlets every single time, 1 to 2 before you go into that setting, before you get on a plane. Bring them with you when you're traveling. And On Guard soft gels if you feel like you're coming down with something, and that's internally, okay? Those On Guard soft gels, we don't like you to take them for more than 7 days at a time because they're really strong, but they're wonderful to help support your body through a viral illness. And diffusing constantly. On guard, on guard, on guard. I always have on guard in my diffuser, upstairs, downstairs. During the respiratory season, we know it kills microbes in the air. It's very, very, very important. And I love to just put the On Guard hand sanitizer or the On Guard roller bottle on my hands constantly, because that's giving me those antibacterial oils that help keep microbes off my fingers. And I love just straight roast daily topically to the feet. Now, hair loss in the process of an autoimmune disease. And this can happen with many different types of undiagnosed autoimmune diseases. You see this a lot with gut autoimmune diseases, certainly in lupus. The hair starts to fall out. And again, remember, root cause, we have to go back and support the gut and do all those things. But one thing that you can do with oils that's been shown to promote hair growth is cedarwood, rosemary, and lavender. And what I recommend you doing, because if you spray this on during the day or add it during the day, it can kind of make your hair look greasy, and nobody wants that. So add it to your conditioner, 2 drops of each. You can just keep them in your shower, and you let it sit for 5 to 10 minutes. And you do that as often as you wash your hair. Finger perfusion. So this, this is if you're dealing with the cold fingers and hands, right? So we want to do heavily diluted warming oils. Remember, clove and cinnamon are some of those hot oils that we love to dilute. But clove, ginger, and cinnamon, you could make a roller bottle of this, right? Just put 10 to 15 drops of each oil in a 10 ml roller bottle and fill the rest with fractionated coconut oil. And you're going to apply it to the hands and just rub it in. And that will create a warming sensation and helps actually dilate the vessels and bring blood flow to those areas. Okay, so let's move on to systemic autoimmune disorders, rheumatoid and psoriatic arthritis. Again, if you are suffering from osteoarthritis, just know that this can apply to you. So let's just talk about some of the differences between these 2 types of arthritises. Arthritises are typically affecting the joints, the bones, joint pain, swelling, but you'll see here in rheumatoid arthritis, you start to really get like real deformities within the finger joints, where you start to see those swan neck fingers. The fingers look sort of curled and mangled, right? Osteoarthritis you sort of see in the wrist joints, right? And then psoriatic arthritis typically carries along with it these rashes, these psoriatic rashes. But you can get a lot of other systemic symptoms with these, which is why I really lumped it into that systemic autoimmune disorder, not just the joint disorders. Because you can really see lots of course, constipation, GI problems, evidence of inflammatory bowel disease. It can affect the mouth. It can affect the eyes, almost like a Sjögren's syndrome, where you have some dry stuff. But really, the main constellation of symptoms is around joint pain, swelling, joint dysfunction. So let's talk about the rheumatoid arthritis. Again, we see this foundation of support for the body, right? Gut health, number 1, right? Number 2, natural support regimen, DDR prime soft gels 2 daily, lifelong vitality with those omegas, probiotics, vitamin D, calcium, turmeric internally, and a veggie-cap copaiba soft gels. I will say for ease, if you just wanted to get a bottle of copaiba and make your own veggie caps throughout the day, you could certainly do that. Add your turmeric, add your copaiba, make those together. But that's the mainstay of the natural support regimen here. I have a feeling in the future we're going to see turmeric soft gels from doTERRA. I just have a feeling that will come. Again, here, fingers and hands, typically the most affected, right? And so finger perfusion can be an issue too here. And so again, those diluted warming oils, clove, ginger, and cinnamon. Again, here with the joint pain and swelling, think the pain protocols. Also think anti-inflammatory protocols here. This is why we add that lemongrass in there and the frankincense or copaiba. For a person with rheumatoid arthritis, this is not something that they're doing occasionally. This is something that I would recommend is at least 2 to 3 times a day in their daily topical regimen of their feet, wrists, knees, wherever they're having their complaints with their rheumatoid. And then, of course, the deep blue polyphenol complex. This should probably actually be moved into the natural support regimen of rheumatoid arthritis category, rather than just saying if you're having joint pain, because that deep blue polyphenol complex is so wonderful for reducing inflammation in the joints, some of the key things in that product, in that supplement. So really, it should be moved probably over to the natural support regimen. So if that's something you wanted to include naturally in that daily support, that would be very smart. Cobiva soft gels, of course, our internal pain regimen. And now psoriatic arthritis. So you're going to see the same recommendations here as above, right? We're doing our natural support regimen, except here we have more of a skin issue, right? Same thing for finger perfusion. Be very, very careful with these hot oils and psoriatic arthritis, especially if you have open wounds related to itching, scratching. I would avoid warming oils if you have open wounds in the psoriatic arthritis department, okay? Same thing for the joint pain, swelling, same protocols. Again, I would probably move the deep blue polyphenol complex over to the natural support regimen side here. So let's talk about something that's different here that the rheumatoid arthritis group doesn't have to deal with, and that's these skin lesions that come up in psoriatic arthritis. So daily topical Immortelle blend. That is a wonderful roller bottle that doTERRA makes. It's typically for anti-aging, but I really like it for skin disorders like this because it's got rose, it's got myrrh, it's got helichrysum, it's got frankincense. It's got a wonderful blend of oils there. I add into psoriatic arthritis skin support turmeric essential oil because I just like to have that anti-inflammatory effect right there on the skin, right at the surface. I love to use extra helichrysum, and then we use tea tree oil and lavender. And the tea tree oil really helps to keep a bacteria at bay here, okay? So a lot of times people will deal with lots of wound and skin infections when it comes to this. And so Melaleuca tea tree oil has some wonderful antibacterial properties that helps us with that, helps support the body to prevent that. And of course, lavender. Really, lavender is the key here for itching, okay? Sometimes this can itch and be very uncomfortable. It also has antibacterial properties, but if you find a lot of itching with the psoriatic arthritis, really go back to lavender, lavender, lavender. And this is, again, this is something that you're doing in the daily regimen. This is not for, oh, I just need it because I have some complaints. Really, people see results from this when they stick to that as their daily regimen, just like the daily support regimen, just like the gut health regimen, okay? I like to dilute this in jojoba oil and not fractionated coconut oil. In a standard dilution of 1 to 3 drops per teaspoon, or if you're doing a 10 ml, you can actually do probably 10 drops of each. And you just have to open up that Immortelle blend and, you know, dump a quarter of the bottle in a new 10 ml roller bottle, and you can make yourself your own roller bottle. Or what some people have done is they'll use up the Immortelle blend till it's about half gone, and then they'll add their turmeric, add their helichrysum, add their Melaleuca lavender, and put some jojoba oil as a carrier oil in there. And again, that's part of the daily regimen, doing that at least twice a day. Or what I tell people too, you can also make a spray. So you can get like a 4-ounce spray bottle and actually put some jojoba oil in it, and then add all of your oils. If it's a 4-ounce, I typically recommend doing about 10 to 15 drops per ounce. And then you can add the entire vial of the Immortelle in there and just spray it on the hands and rub as needed. That would be nice, something that would probably last you quite a few months and would be easier. Now for the winter, I typically recommend people make a balm. I've put a couple recipes in the Essential Oil Solutions group, which I'll post again this week. You can make a balm with actually coconut oil, jojoba oil, and you actually melt down beeswax. And you add myrrh to it, and that's because the skin typically gets a lot drier in the winter, and you need some sort of barrier protection. And the beeswax gives you this beautiful barrier protection that sort of stops the skin from drying out. Okay, so now let's move to thyroid support. I know this is a lot, but hang with me. We're getting close. So thyroid support, right? So we really have two typical disease processes when we're dealing with autoimmune support of the thyroid. Underactive, which is Hashimoto's, which is, you guys, we're just seeing an epidemic of nowadays. And then we'll talk about Graves' disease. But in the underactive Hashimoto's disease, and the reason, you guys, this is considered and lumped into systemic autoimmune disease is because your thyroid and your thyroid hormone literally affects every single organ in your body. There is no other hormone that has quite the effect that the thyroid hormone has. So it's vital to the body. It's vital to metabolism. It's just vital to the heart. It's vital for so many different organs. And these antibodies actually attack the thyroid and destroy the tissue with inflammation. And they actually make an inability of the thyroid to produce the thyroid hormone. And again, this causes systemic repercussions. Okay, so again, we see this natural support regimen. We're not dealing with a lot of pain here, but we are dealing with a lot of sluggishness, right? So again, if you're suffering from this, or you know that someone is, go back to those symptoms that they're having and say they're suffering with energy, and you need to go back to the group and search for energy protocols, like what people need to do to improve energy, okay? We can't go through every single symptom, but we just don't have the time. DDR prime, lifelong vitality, probiotics, turmeric, vitamin D, cobaiba soft gels. The mainstay regimen of getting anti-inflammatory oils in the body, supporting the body with foundation of nutrition, very important. So you're going to apply this twice daily. We have a topical regimen for you. And so twice daily, topically to the thyroid area. That would be peppermint, clove, lemongrass, and myrrh. Okay, and really simple, just to make a roller bottle, fill it halfway up with fractionated coconut oil, put about 10 to 15 drops of each oil in there. And that's going to last you a couple months. And I just tell people, keep one roller ball by your bed. And when you wake up in the morning, just rub it on your thyroid area. And the same time at night. And so, like we talked about for symptoms, we cannot talk about every symptom related to this, because literally people that have underactive thyroid have lots of symptoms. They're cold, they lose their hair, they feel really, really tired. It's very difficult for them to function. A lot of people have come to me and said, I really want to support my thyroid naturally. I don't want to take thyroid medication. I can never, ever, ever get on board with that, especially when people have a severely underactive thyroid. This is a life-threatening disease process. Please, please, please work with your physician and make sure that you are taking the wonderful things that have been developed by modern medicine to make sure you have enough circulating thyroid hormone. Again, these are all the things you can do to support your body and support the thyroid. This is very, very important when you're dealing with this disease process. Again, for symptoms, go back to that hair loss. If you're dealing with that, go do the hair loss protocol we just talked about. If you feel cold, go do the warming protocols that we just talked about. You can use them on your whole body. If you're feeling tired, some of the energy protocols, right? The lifelong vitality is very important for that. Using lots of peppermint and lots of stimulating oils, cinnamon, very good for that. Okay, so thyroid support over active thyroid disease process, which is also called Graves'. These are common symptoms, lots of weight loss, irritability, anxiety. Like you see the lady in the picture, like they have what we call ophthalmopathy or ophthalmos, where the eyes look like they're protruding from the eye sockets. And that's very reflective of how they feel. These are very highly anxious, irritable people when they have hyperactive, overactive thyroid disease. And it's just the immune system actually attacks the thyroid and then triggers it to make more thyroid hormone than your body needs. Very, very debilitating. Okay, again, we go back to this natural support regimen. Typically, when you're working with modern medicine in this, you'll see they do radioactive iodine to destroy part of the thyroid. They may do thyroid removal. And then a lot of times when you have thyroid removal or destruction of the thyroid gland, you have to go back and support it with thyroid hormone, right? So you're going to see this flip-flop, okay? Don't be afraid of that. That's the modern medical approach to treating this disease process. Thank goodness we have those regimens, because people can die from this when not treated. So it's very important that you follow your physician's recommendations if you're suffering from this disease process. Applied twice daily, this topical regimen to the thyroid area, myrrh and lemongrass. These are the two oils that we use for that. Same thing, mix a roller bottle, a 10 ml roller bottle, add 10 to 15 drops of each, keep one by your bedside, wake up in the morning, do it at night. Again, for consideration of symptoms, these people are anxious. Think about lavender internally for anxiety. So to support them through the symptoms as they're being treated, I do lots of lavender for anxiety or stress, for rapid heart rate. There's other medications that can be used for that, but you can also use very calming oils, right? Lots of vetiver, lots of ylang ylang, lots of marjoram, and aromatically. Neroli is wonderful for this. So lots of oils that are calming, sort of more sedating, especially that lavender internally. Serenity soft gels can be fantastic for that. So think about all the symptoms that you need to support, and think about sort of those calming oils. Peace Blend is wonderful for this too. Okay, so now moving on to skin autoimmune diseases, which unfortunately so many people suffer from. I get questions about this almost daily on social media. And it's debilitating. It's awful for people. So psoriasis becoming more and more common. We typically talk about it and define it related to coverage and severity. This is like how much is appearing on the body. So mild, moderate, and severe. And they actually are plaques. And I think I had a little picture here. I must have moved my picture for psoriasis. But they look like just plaquey areas of very strong inflammation. And the skin is sort of hard and crusty. And so severe is more than 10% of the body has psoriasis. And it's immune-mediated disease. And you'll see the skin be kind of raised and scaly. And can be very itchy. So again, gut health, right? Get to that natural support regimen. And you'll see a couple things I added to the skin autoimmune disease natural support regimen protocols. Absolutely Whole30. I have seen people psoriasis and eczema completely reverse with this natural support regimen over the course of 30 to 90 days. And I always tell them it's going to take months because you must heal the gut first. So it's not just a topical application. We do topical application of oils during this process, but you have got to heal from the inside out. Really think about fluids here. When you have open, especially if you have severe psoriasis, people forget about hydration, but if you are messing with the skin and the skin integrity, especially in the heat, especially during the cold and winter months, you must stay hydrated, lots and lots of fluids. Because your skin is compromised, you may lose more fluids through the skin integrity being compromised. But absolutely, these people have to think about a Whole30 diet, usually for 60 days. And then the skin regimen is this, that Immortelle blend that I love that has all of those anti-inflammatory oils in them. Helichrysum, thyme is one that you'll see here, and you'll only see it in this skin regimen. Please make sure and dilute this in jojoba oil. Thyme is a hot oil, okay? And if you do not dilute it with psoriasis plaques, it can be very irritating to those tissues. Lavender, melaleuca, Roman chamomile. Yarrow Palm is a new one I've added because it's so wonderful for the skin. We're seeing lots of improvement in skin lesions with Yarrow Palm. And please dilute this in jojoba oil. Again, I use jojoba oil here because it's non-drying, it's very nourishing for the skin, and I choose this over fractionated coconut oil for topical application in these types of people. Considerations for the winter and itching. Excuse me, sometimes you really have to just keep lavender around for this and apply every couple of hours. I like to do that skin regimen twice daily, morning and evening. That's part of a standard regimen for people with psoriasis plaques. But for winter and itching, you really just need to keep lavender with you all the time. Apply lavender diluted topically. And for open wounds, please don't apply the daily skin regimen to open wounds. So if you have open bleeding wounds with psoriasis plaques, essential oils directly in open wounds can be very irritating, especially that hot oil time. So be very, very careful with that, okay? And just make sure that that kind of crusts over before you start to apply some of those oils, even diluted. Eczema, it's such a horrible, horrible situation for many children and some adults. Again, you'll sort of see this described, atopic dermatitis. It's very interesting because when we go and heal the gut in these people, I've done it probably at least 50 times over the last 3 years using the same regimen, and you start to see the skin heal as you heal the guts. Incredible healing from the inside out. Those eczema symptoms include itchy, red, and dry skin inflammation. It's most commonly found, yes, in young children, but I've dealt with a lot of adults that get it and have had it throughout the ages. Go back to the gut, go back to the gut, go back to the gut, especially with eczema. This is so important. Using this natural support regimen, don't worry, hang with me. We're going to talk about kids in a second. But for adults, this is what I have done, and it works. It works. It works. There's so many pictures in the Essential Oil Solutions group. You can go back and search for it yourself of people with skin improvements with eczema, people that had severe eczema. You have to do the food part. You have to do the food part on this. Again, fluids is very important when the skin is open like that. You are compromising the skin integrity. These people need a lot more fluids than they think. Twice daily skin regimen, very similar to the psoriasis one. Excuse me. But notice you don't see thyme here. Thyme is too aggressive for people with eczema and atopic dermatitis. So the Immortelle blend, helichrysum, very important oil for this. Lavender, melaleuca, yarrow palm, diluted in jojoba oil. Again, that nourishing oil. And again, remember, Immortelle has our frankincense, has our rose, has our myrrh, has all of our skin oils in there, okay? Again, considerations for winter and itching. That balm that I'm going to post this week, very, very important to use that in the winter to kind of protect the skin and provide a barrier. That beeswax really does that. Itching, eczema, you just got to keep lavender with you all the time, and sometimes you have to apply it 2 hours. Again, please don't apply essential oils to wounds that are open, excoriated, bleeding. Wait for that to kind of heal over, then you can. You know, sometimes to those wounds, what I tell people you can do, just do jojoba oil and just let that kind of heal over, crust over, and then you can apply the essential oils. Okay, so let's talk about kids. So for kids that are over the age of, I would say probably 4 to 5, you can use DDR Prime topically. We don't use internally with kids that young. I love the Kids Stronger blend combined with DDR Prime. You can make a roller bottle, just use up some of the Kids Stronger blend, like probably I would say about 1/8 of it, and then add the DDR Prime blend into that, and you've got yourself a nice little roller bottle for kids. On the bottom of the feet twice daily. So in the morning and evening, keep this by their bedside. Absolutely no gluten or dairy, and absolutely no sugar. Very difficult in our society today, I understand. You cannot do complete elimination of grains in children because they really need those carbohydrates, especially for making different types of nutrients, and it just devoids them of calories too much, and we know that they are calorie burners. Children, that is. Lots of fluids for them too, especially in young little babies, because the skin integrity is so compromised. Detox products, for heaven's sake, personal care products, lotions, everything you've got to think about in kids with eczema. I see some of these products that are like all natural eczema treatment. No. Go read the ingredients. You guys need to think very, very simple here when you're applying things to the skin in children with eczema. I mean, jojoba oil and essential oils, that's it. None of these, eczema regimens, because they have chemicals in them. Food sensitivity testing can be very important, especially for children in this arena, because if you don't find out what they're sensitive to and you keep feeding it to them, their bodies are so little, and where you and I might be able to tolerate some of the inflammation, they just can't, and it makes them flare. So I'm just telling you this. You can't do an elimination process like a Whole30 in them. It's too restrictive for children in their diet. Please just get them food sensitivity testing. Find out what their sensitivities are to so you can remove those foods from their diet. PB Assist Junior, I really like to do for kids over the age of 3 or 4, or 2 and up can have these, but I like to do 2 to 3 per day. And so for babies, there's a wonderful probiotic called Avivo that I like. And I recommend that. And of course, the Kids doTERRA vitamin, recommend 2 of those. Kids Omegas, the Omegas are extremely important for people with eczema, because we're wanting to heal the gut and we're wanting to create this anti-inflammatory approach. So the doTERRA Kids Omegas is a very important part of their regimen daily. So their daily skin regimen, again, you see that Immortelle blend with helichrysum, lavender, manuka, and yarrow palm diluted in jojoba oil. I used to only do helichrysum, lavender, and manuka, and I've sort of accelerated this for kids because that Immortelle really has some oils that they need, like myrrh and rose. So we're going to dilute this a little bit differently than we do for adults, right? So we'll make a roller bottle with jojoba oil, and we'll put 10 drops basically of each of these oils in there, okay? For little babies under the age of 2, I tell people 3 to 4 drops of each of these oils. And again, keep a roller bottle with them for the itching, because these kids will itch, and they create horrible lesions on their skin. It opens them up for infection, and we don't want that. So keep lavender around to sort of prevent some of the itching. And again, open wounds, please don't put these oils in open wounds. Wait for the skin to heal and crust over. Okay, wow. I'll take a deep breath. Oh, that was a lot, right? Probably one of the longest Wellness Wednesdays that you ever have, but I hope this helps. So coming up next week, we're going to be talking about supporting the body through gut autoimmune disorders, irritable bowel disease, including irritable bowel syndrome, ulcerative colitis, Crohn's, and celiac disease. So thank you guys for sticking with me. I hope you found some of this to be helpful. If you do have any questions, please post them here. And I'll be posting some of the recipes that I use to kind of support the skin, especially my winter balm recipe for people with skin autoimmune disorders this week. So stay tuned for those, because that'll be something you can go ahead and start making and prep for winter, even though it feels like it's hellfire outside and so hot right now. Winter is coming. So thank you guys again. And thank goodness we got through it without any more internet issues. Hooray. You guys have a great night, and we'll see you live next week.